Hello, I'm Sarah Wilcox, and I'm a professor in the Department of Exercise Science. I've been at the University of South Carolina since 1999. My work is really motivated and driven by two primary questions. The first question is, why is it that people don't engage in healthy lifestyles? So why don't people take part in regular physical activity, and why don't people eat healthy diets? The second question is, how can we help people and communities to become healthier? So consistent with those two questions, I have two lines of research. The first is to understand barriers or factors that get in the way of, as well as enablers or factors that help or enable healthy behaviors. And I'm interested really in studying those factors from the individual all the way up to the environment and even policy. So what are things about a person's physical and social environment that may help or hinder them to become more physically active? The second line of research is to study and develop interventions to help individuals and underserved communities to become healthier. And most of my research has been conducted with older adults, women, and African Americans. I also direct the University of South Carolina Prevention Research Center. Our Prevention Research Center has been funded for 20 years continuously by the Centers for Disease Control and Prevention. And the Prevention Research Center is really focused on promoting health in communities through physical activity. Over the next few minutes, I'm going to talk about one of my passions, which is promoting health in older adults. And I hope that as we spend this time together, you'll get a better understanding of why I'm so interested and motivated by this area of study. Unfortunately, I find that when I mention older adults and the topic of aging, this type of image comes to mind. An older adult who is sick, maybe confined to a bed, maybe alone and lonely, and dependent on others. I like to remind younger adults that ageism is different from sexism, racism, and other isms, and that if you're lucky enough, you will actually become old. And I'm guessing that when you think of yourself in aging, you probably have a more hopeful and optimistic view of what you will be like. In fact, did you know that less than 5% of older adults on any given day live in an institutional setting like a nursing home? And of those who live in the community, only about 6% need help with personal care. These numbers are a lot lower than most people think. You probably already know that people are living longer. So a girl born in 2013 can expect to live on average about 81 years. And the life expectancy for a boy born in that same year is about 76 years. But for most older adults, what matters most is not necessarily how long they live, but rather the quality of their life. Older adults want to live as independently as possible for as long as possible. Being frail, having difficulty getting around, and being dependent on others are some of the things that older adults fear most. Older adults fear losing their independence, both from physical conditions, such as a hip fracture or complications from diabetes, but also from conditions such as Alzheimer's disease and other types of dementia. 3 health behaviors make a substantial difference in the quality of older adults' lives. First, engaging in regular physical activity or exercise. Second, not using tobacco. And third, eating healthy. I'm going to show you just one graph today. I show it because it really speaks to how health behaviors can play a vital role in the lives of older adults. In this study, published by Anthony Vita and colleagues in the New England Journal of Medicine, around 1,700 university alumni were surveyed in 1962 when they were 43 years old. They were then surveyed every year starting in 1986. Among other things, their smoking status, body mass index, and exercise status were assessed when they enrolled in the study. Those who were most healthy, that is, they did not smoke, they were normal weight, and they exercised, delayed the onset of disability by 7 years compared to those in the high-risk group, those who were overweight or obese, smoked, and did not exercise. Another message I hope to leave with you is that it's never too late for a person to benefit from physical activity and healthy eating. The 2008 Physical Activity Guidelines for Americans state that promoting physical activity for older adults is especially important because this population is the least physically active of any age group and thus has the most to gain. Older adults are a diverse and varied group. Most have one or more chronic conditions, and the severity of these conditions also vary. But whether an older adult is fit and healthy or frail, he or she can still benefit from regular physical activity. Let's take the case of a frail older adult. There's a researcher in Australia, Maria Fiataroni, who has shown that frail nursing home residents who took part in a program of progressive strength training showed marked improvements that were clinically meaningful in outcomes like walking speed, stair climbing power, and thigh muscle size. Older adults achieve the same benefits as younger adults from physical activity: a lower risk of coronary heart disease, high blood pressure, type 2 diabetes, and colon cancer, just to name a few. But for older adults, in addition to all of these benefits, there is strong evidence that being physically active is also related to higher levels of functional health. In a national initiative that I evaluated, Active for Life, we heard that many older adults had goals such as being able to walk independently to get their mail, or being able to play or even pick up a grandchild. Another benefit of particular relevance to older adults is the risk of falling. Older adults who start a program of regular physical activity substantially reduce their risk of falling. And finally, a growing and very exciting line of research is cognitive health. The research is fairly strong to show that healthy older adults, and even adults with existing cognitive impairment, can improve their cognitive function or delay the rate of impairment. Also, much of the research linking exercise with improved sleep has been conducted with older adults, who tend to report more frequent sleep complaints than younger adults. Again, the evidence is fairly strong that exercise improves sleep. Just like older adults may benefit in unique ways from physical activity, the barriers that they face to physical activity and healthy eating are also unique. I like to think about barriers and enablers within a social ecological model. For example, an individual level factor that might be a barrier to engaging in physical activity is having a chronic health condition like arthritis. Even though arthritis symptoms are reduced with regular physical activity, arthritis is often a barrier because of issues of chronic pain. A social barrier to healthy eating can be the loss of a spouse. Meal times can lose their pleasure, the older widow may not see the point of cooking for one, and malnutrition can eventually occur. Environmental barriers to physical activity include perceived crime, which older adults are especially sensitive to, or inadequate time to cross streets due to crosswalks that are really designed for the walking speed of younger, healthier adults. As a society, we need to challenge our myths and stereotypes of aging, and rather than holding the view that it's too late, we need to say that it's never too late. Older adults can, and many do, lead productive, healthy, engaged lives. Our challenge as public health professionals is to understand the unique needs of this population and address these needs in our programs, healthcare, and policies. It has been a pleasure talking with you today about aging and public health. Chances are, in both your professional and personal lives, you'll have many interactions with older adults, and I hope many opportunities to promote quality of life in the lives of older people.